Here is another very commonly asked question. A patient will usually start with the description of their refractive error. They might say, my power is minus 3.5 or my power is minus 5. Am I eligible to undergo a laser? Whether you are eligible to undergo a laser or not will depend upon many factors. One would be the magnitude of your power, whether you are having a minus 1 or a minus 3 or a minus 10 power. It will also depend upon the stability of the power, how long this power has been the same, whether it has fluctuated over the course of the last 1 year. It will also depend upon the shape of your cornea, whether you have a thick cornea, a thin cornea, and whether the shape of the cornea is normal or whether it is outside the limits of the normality. All of these can only be tested accurately once the patient walks into a center for a visit. Some patients might have a really high power, but there might be still eligibility for the laser because the cornea is very thick. Some patients might have a low power, which would be generally very easily treatable by the laser, but they might have a thin cornea, which would disqualify them from any laser-based treatment. So these patients might require a lens-based treatment instead. So it is genuinely very difficult for me to answer those questions. All of these can only be answered and measured very accurately when you come into the clinic. We will either decide for a laser treatment or a lens-based treatment to correct your power. Regardless of your power, your corneal thickness or other factors, there will be some procedure for you that will give you your glass freedom that you desire.